One day in a village that was endemic to many cases of dengue fever. At one time, there was a teenager in the village who had a fever and had no health signs 3 days, which was accompanied by a red small spot on his hand. His parents immediately took him to the hospital to be examined further about what his illness was. When they get to the hospital,
Nurse, yes, I can help you, ma'am. My son is sick, nurse. Where? Here we go. So, this is my son. Has been since 3 days ago. The fever didn't go down and down. A few days ago, I felt a little red spot. Oh yeah, I almost forgot when he was brushing his teeth. Usually, the gums will come out blood. I guess my son is sick. What is nurse? I cannot compare it yet, ma'am. I will do a preliminary check first, so everything is clear, ma'am. Yes, nurse, please. Okay, alright. I will do a preliminary examination. Excuse me, mister.
Yes, of course, nurse.
If from physical examination, the abnormal condition here is only the emergence of petechia, which is more than 20. There are signs of bloating in the stomach and also looks a little dehydrated. Then it shall be suspected of sign of dengue symptom. Then we shall check first to the laboratory, especially the blood to check platelet level of your son. Give my son treat the best nurse. Yes, ma'am.
after that, a complete blood test is performed.
Okay, with Mr. Difficult, I'll take the blood sample first, okay?
Please, but does it hurt?
Of course not. It just feels like being bitten by an ant.
Yes, please, nurse.
Okay, are you ready?
Samples were taken to the laboratory and the test results were found that the platelets from Mr. Jufical below average in positive dengue fever. After the examination and sampling of the blood is finished, the patient is brought to the inpatient room for further intervention to overcome the complaints complained of. Before that, nurse takes the patient and his family to the ward. Nurse returned to the nurse station room. The night arrived. Because the fever didn't go down, the patient was very restless to the point of sleeping delirious and agitated. Because his parents were worried, they immediately called the nurse to examine her son.
Look, my son, very nervous and gives out a lot of sweat. When I hold his forehead, the temperature is very high, nurse. Okay, ma'am. I will be there soon and check the temperature of your son. Of course, nurse. Thanks.
Then they rushed to the room. The nurse immediately checked the temperature of the patient with a thermometer, and the result showed the patient's temperature was 40 degrees Celsius. Just as she felt nervous and delirious was not clear. The nurse also reported to attending physician for collaborative therapy that would be carried out while she would take a one complex.
Hello, with Dr. Lila.
Yes, I am nurse.
Just in charge of the internal space, I want to report the recently Mr. Dulfical fever with a description of the temperature 40 degrees Celsius, and the family complains that the client is restless and delirious while asleep. My plan will be to take a warm compress and relaxation therapy to calm client. According to the doctor, what should I am to intervening in this patient, doctor?
Action.
Good, do it and with giving some more drops for 1 hour and then monitor its development.
Of course, doctor. Thank you.
Then the nurse returned to the room and provided therapy while doing a warm compress. Excuse me, because the fever is already 40 degrees Celsius, I will give you some mild drops stroke an IV catheter and also a warm compress which I'm to reduce this fever. It takes about 5 until 10 minutes until you feel a little better. How are you feeling?
Yes, of course, nurse.
Nurse began to do warm compresses and relaxation therapy. Well, the action is complete. I will return to the nurse room. If necessary, me or my friend, please contact us in the nurse room.